You're listening to the Cancer Assist podcast. Wherever you are in your experience, we are here to provide help and hope as you navigate cancer prevention, treatment, and care. Hosted by Dr. Bill Evans and brought to you by the Cancer Assistance Program. Help when you really need it.
Well, welcome to the Cancer Assist Show with Dr. Bill Evans. That's me, and we're delighted to have you listening today, and we're going to talk about a topic that doesn't get much attention, and it may be relevant to you or to a loved one, and so we hope you'll listen to this conversation about lymphedema, and we'll explain what lymphedema is all about. Before I dive in, I do want to say a few words about the Cancer Assistance Program. We do this show in order to make people aware of the services in the Hamilton region for cancer patients. And if you're a recently diagnosed cancer patient or a caregiver to a cancer patient, you may want to know about those services that include things like free rides to the Cancer Centre, free equipment loans. We have a vast variety of different pieces of equipment that can help keep your loved ones safe in their homes. We have nutritional support, even food delivery to homes for individuals who need it, can provide mastectomy supplies, urinary incontinence supplies, free hair pieces, and so on. So we really want to make people aware of the Cancer Assistance Program, and one of the things we do is these podcasts to educate people about the services that are available, about how cancers are being treated, hopefully to make people more informed so that they can ask their doctors and healthcare providers questions that will help them navigate what is often a difficult cancer journey. And so I'm delighted today that we'll have our special guest, Michele Cardoso, who's a clinical specialist and radiation therapist at the Juravinski Cancer Centre, and she's going to help us understand this lymphedema situation. As I say, it's not something that is a common household word. I don't think most people, in fact, understand what lymphatics are or even lymph nodes, but it's all tied together. And so we're going to have this conversation and make it all crystal clear. So welcome, Michele. I'm just delighted to have you here for the podcast today.
Yeah, it's lovely to see you again. Thank you. And it's true, nobody thinks about lymph nodes and lymph until they hear the conversation with their oncologist about removing lymph nodes or treating lymph nodes. So some of us can remember when we were children having the doctor feel our neck when we have a cold, and those little swollen glands in our neck are the same thing. Those are the lymph nodes. So lymph fluid is continuous with the fluid that bathes all our cells, the tissue fluid. Every time our heart beats, 1% of that fluid volume is trapped in the cells, and the only way it can come out is through the lymphatics. So it's another part of, it kind of complements the circulatory system, so it's part of getting that fluid out of the body is a big part of what the lymphatics do. It's responsible for fluid balance in the body. But so we know when you get swelling in your ankles after walking for a lot or standing a lot, it's the same principle. But what happens when you have a cancer treatment, it damages the lymph nodes. So there's less available to help drain that fluid. So the lymphatic system is responsible for fluid balance in the body. It's also part of the immune system. There's a lot of white blood cells concentrated at various organs within the lymphatics, like the thymus and the spleen, and the lymph nodes themselves. And it's also involved with fat transport as part of digestion. So we should talk about it more because it has a lot of jobs to do.
Well, it's a parallel vascular system. Mm-hmm. Everybody understands, I think, that we've got a heart and we've got veins and we've got arteries.
That's right.
The blood circulates, but nobody seems to realize there's a parallel system that's transporting fluid around our bodies because there's an imbalance in pressures. On the arterial side of the little vessels we call capillaries, there's a tendency to push fluid into the tissues, right?
That's right, yeah.
And then it doesn't all get absorbed back. So if we didn't have a lymphatic system, I think in a short time, we'd probably all blow up and look like the doughboy or something.
Yeah.
And so we need this system, and it's got to bring that fluid back into our heart, which it does through a rather large duct in our chest called the thoracic duct, and it dumps this clear fluid back into circulation the way it goes again. Yeah. So it's an essential mechanism for keeping a balance of fluid in our tissues.
Yeah.
But as you say, it also has this important immune system, and because the lymph nodes contain those many kinds of cells, but some of those cells are there to particularly fight viruses, bacteria, etc., as well as cleansing of even things as simple as dirt that gets in through a cut.
It's removing waste from the cells, bacteria, viruses, all of that are removed into the lymphatics. But it's not an efficient system. It's not like the bloodstream that has the heart pumping. It really relies on musculature in the walls of the vessels to help it move along, and our movement to help squeeze the muscles against the skin to move that fluid along. So, once patients have had lymph nodes removed by surgery, or they've had radiation to the lymph nodes, or even taxane therapy can contribute to lymphedema. Once the burden is there of having those lymph nodes removed or damaged, it puts a stress on the remaining lymph nodes. So then what happens is the limb next to where the lymph nodes were removed becomes swollen. So for breast cancer patients, which it affects the most, when they've had lymph nodes removed from the axilla, the armpit, they end up having swelling in the arm or even in the chest area.
And that's when we call it lymphedema.
That's right.
So we've talked about the lymphatic system, and edema just means swelling.
Yes.
So that's swelling in the extremity. That's this accumulation of lymph fluid that should get back to the heart but can't.
Yes.
And so you get a rather dysfunctional appendage. Could be an arm, could be a leg.
Yes.
Could even be with
we have head and neck
problems as well, right?
Yep.
We jumped right into this, but
Sorry.
I didn't get
too fast.
ask a little bit about you, because I always like to know a little bit about the people I'm talking to, and I'm sure our listeners do too. And I know you're a radiation therapist, but you've become somewhat specialized in this area as well. So maybe a little bit of your background.
Yeah, I have Margaret Forbes to thank for that. She's an advanced practice nurse.
Yes.
She's a pretty spectacular human being. But she had a lot of wisdom and foresight, very much embraced into professional practice. And when she had a lymphedema clinic at the Juravinski Cancer Centre, there was so many people that had to come and see her. And some of them just had education needs. So we developed a class just to teach those patients, and she got me involved with that, and it was a wonderful experience. And so then I would teach the class, and eventually, unfortunately, that clinic closed. Margaret has moved on since then. And so I've kept the class running, and I've tried to keep navigation sort of at the forefront of what I do, so that the patients know who to go to and what to do when they have any signs of swelling. But yeah, that's how I kind of fell into it. Yeah.
Well, I'm glad you did, because it's an absolutely necessary service.
Yeah.
So you touched a bit on why people get lymphedema, and I guess it's kind of multifactorial, isn't it?
Yeah.
It could be because the surgeon has had to cut those lymphatic channels, and say taking the lymph nodes out from underneath in the armpit area, or for, say, someone who had a melanoma or sarcoma in the lower extremity, dissecting in the groin area.
Yes.
Those things of physical cutting. But then radiation, and you're a radiation therapist.
Yes.
And so oftentimes radiation has to be delivered to an area of the body, and it has an effect on the lymphatics, doesn't it?
Yes, absolutely. In fact, it has a similar effect to having lymph nodes removed, like the similar risk factor, I guess you could say. So, compounding all of these things probably makes the risk much higher. So it's something that is discussed up front when the patient comes to consent for treatment. But, it's at that point the focus is on just getting through the cancer. When lymphedema appears after that, it's very devastating for the patients, because they feel like they've got past the cancer diagnosis in many cases, and then now what? Now what's this? And it's quite devastating, because lymphedema is a chronic condition.
Yeah, there's real no cure for it. It's something you have to manage as a kind of chronic condition once it occurs.
Catching it early is very important, because if you deal with it in the early stages, it never has to become, and I'm sure people have seen pictures of these big elephant limbs, which are quite debilitating and difficult to deal with. But if you catch it early, you can keep it quite minimal. It is at the beginning shock and awe and very difficult for patients to kind of wrap their heads around. But if it becomes part of their daily practice. I wake up, I do my skincare, which we'll get into, I think, and put my compression sleeve on or garment on, and go about my day. Building in exercise as well in that day. So, it becomes part of how they cope, and it doesn't have to be this horrible thing. But yes, it's a compounding diagnosis. You've already had this horrible experience, a traumatic experience, and now you're faced with a chronic condition. Having said that, there's lots of promise and exciting research coming out from Stanford. Stan Roxon has done some amazing work with his team. And they're thinking of it slightly differently. We always thought of lymphedema as sort of a traffic jam, some blockage or diversion of the fluid. But he's saying, what if it was an inflammatory process? So there's some exciting things going on. They did some mouse studies. Now they're into human studies. Finally, research is slow. But they're looking at this compound called ace-bilostat, which is an anti-inflammatory, targeting a pathway, and the results already, the early results are amazing.
Well, that's really exciting to hear. I was unaware of that, and I kind of had assumed that progress hadn't been made against lymphedema because it's just been around for so long, and it seems to me we've been limited to compression, massage, exercise, a few other things that we should talk about in a little more depth. But before we maybe dive into that, also important to make mention of the fact that the cancer itself can cause lymphedema by clogging up the lymphatics. So there's really those three things: the treatment with surgery, the treatment with radiation, and the actual tumor itself. But over my career, I've seen a gradual decrease in the amount of lymphedema occurring, partly because surgery's become a lot less aggressive. We've been talking about breast screening and finding breast cancers early. So, and with sentinel node biopsies, you don't have to have these big operations to clean out all the lymph nodes in the axilla. So the risk of getting arm edema is less.
Yes.
Even in melanoma, same sort of approach and much less radical surgery. So, is this actually the case? I'm assuming that you're seeing fewer patients who need care for lymphedema.
Yeah, we do, and even with our modern radiation therapy techniques, we're trying to limit dose to the normal tissues, and we're very, very, very careful with planning. But also we're finding other lymph nodes that we need to treat. For example, with breast cancer, where our local regional treatment is coming across the midline a little bit more to include internal mammary nodes, which we didn't do many years ago. So we win some, we lose some in a way, but the knowledge is there, and we try to let patients know up front what they can do. We never used to think of lymphedema as preventative, but there is in fact some evidence growing to say some of the same practices that we're advising to do in the post-surgical recovery period are also valid in a unfortunately, it's lifelong interventions that you'd have to do, but you can go a long way in preventing. Just knowing what you can and can't do. I don't know if you're ready to go into those things, but infection prevention, for example, because sometimes if you have an infection in the limb, it can provoke lymphedema to begin. So just looking out for signs of infection, treating it early, that sort of thing. Maybe
before we delve there, maybe just to describe for people who maybe don't know what we're talking about, what would a lymphodematous arm or leg look like? And how is it, and how does it affect a person's quality of life and what they can do?
Yeah, so in the beginning, when the swelling starts, it's really only the patient that's aware of it. And it's just sort of a heaviness and achy feeling in the arm or leg, typically. As the swelling starts to accumulate, it's typically for a breast cancer patient in the forearm and the hand. For lower extremity, they can see it maybe in the ankle and the feet, more so than other parts, but it can be anywhere in the leg or the arm. And it starts to be very apparent. You can't bend at your fingers very easily or toes, and shoes become uncomfortable if it's lower extremity. Clothing becomes a little tighter, rings don't fit, those kind of things. Yeah.
And so a variety of functions, particularly for the hands, when we think of how much we use our hands on a daily basis, can be really impairing activities of daily living. And then there are it can, as it progresses, gets thicker and thicker, and the tissues get really quite firm to hard even.
So if you left it alone, it continues to accumulate. And unfortunately, what then happens is collagen fibers start to be laid down. So fibrosis happens. And then fat gets deposited in between those layers. It's like a network of fibers that the fat gets in there. And then it becomes very difficult to reverse at this point. In fact, maybe it starts to be impossible to reverse. And then that's when you see these giant limbs that are very swollen, very painful, and limit the movement.
So this is why you're saying it's very important to identify it early and to intervene early.
Yeah.
And when it is advanced like that, there's a lot of risks of infection because the skin is so tense and easily injured, like scratching it or a little trauma could introduce infection, and then that's a hard infection to treat, and also makes the edema so much worse too, right?
Yeah, so skin infection, cellulitis, goes hand in hand with lymphedema diagnosis. Often the infection might come first and trigger lymphedema to begin, but for people who already have lymphedema and they get a skin infection, the cellulitis, often that becomes a vicious cycle of repeat infections, and they're horrible infections. They end up, often needing to have hospitalization for that. So definitely, the earliest sign of a cut or scrape on your limb that's adjacent to the lymph nodes that were removed, or next to the lymph nodes that were removed, you want to treat those immediately. So you want, if at home, polysporin. Or if it's red or warm, you want to go and see your doctor and get some antibiotics.
And treat it seriously as opposed to it's a little red or a little tender. It really can be an important thing. I certainly recall from earlier in my career when I don't think we had the knowledge that you're imparting now. People who got quite marked infections and very stubborn to try and clear up, and often requiring intravenous antibiotics because you can't the antibiotics didn't penetrate into the tissue to fight the infection that was there. So early intervention. So what are some of those early interventions, and how should people be managing the lymphedema?
Those mainstays of that you mentioned of lymphedema care, skin care, exercise, watching your body mass index, and engaging with a lymphedema provider in the community. There are lots of providers. So skin care is something we can all do at home. You have to inspect the limb daily. You're looking for any signs of cuts and scrapes and so on. And then moisturize. You want to keep the skin clean first and then moisturize. The moisture helps the skin to retain its integrity. It helps it stand up better to infection. And then once that's done, it's something so simple, but it's becomes a daily habit. And we actually want patients to continue that from the time of surgery, and as a preventative. The other part of that is looking at exercising the limb. So if you exercise, there's limb-specific exercises actually we have on our website if people need to look at that. And it helps to drain the fluid as well, because what happens is the muscles push against the skin. The counter pressure of that is what the compression garment would do as well. And that helps the lymph to drain in addition to that. Body mass index is another important thing to look at. So that's a ratio of your height and your weight.
So how does that influence my lymphatics?
Yeah, so the thing is, we want to keep our body mass. So the body mass index, ratio of your height and weight, you can actually go online and look at a BMI calculator. I tend to go on there and I'll just type in my numbers, and if I don't like them, I just change them until I like them. But I'm not suggesting that everyone does that.
I have to make a lot of changes right now myself.
But you want to keep that number less than 30 to be out of the risk group for lymphedema. By doing that, what happens is when you have that extra layer of fat between the muscle and the skin, it kind of reduces the efficiency of the pumping action of the muscles, helping the fluid to drain.
I see. Okay, that makes sense. Yeah. Because people need to understand that the lymphatics, these little channels, they have valves in them. So when you compress, then the fluid will move in the right direction won't go backwards.
Yes.
So the exercise is helping to keep that
Yeah.
moving through your system the way it's supposed to.
Yes.
But if there's too much in the way, like fat,
Yes.
then you won't move as much fluid,
That's right.
so you will have less ability to clear the lymphedema. Oh, that makes sense. Okay.
Yeah. Yeah.
I've learned something today.
Yes, there you go. There's lots of exercise that's really good, but we really need to emphasize that we want people to go low and slow. This is not a no pain, no gain kind of situation. We want you to start with where you are after having all the treatment. You may not be as up for exercise as you were before. So start slowly. The limb-specific exercises are really important, but also general exercise is great to just, it does so many things. It also gets the lymphatics going, and it's for well-being. It's for all of those things. Cancer Care Ontario recommends 150 minutes of exercise over 3 to 5 days. So it works out to about 20 minutes of exercise a day. So you can do, I tell patients to start with walking. Walking is fantastic, and, you can set goals for yourself and, whatever you're doing today, do a little bit more tomorrow. I found having a Fitbit or a pedometer very motivational to get going.
These are lessons for all of us, not just for those of us with lymphedema, right?
Yeah, I started with a friend of mine, Nalini, gave me a pedometer. It's like a cereal box kind of one, and you just clip it on your waist. It's not high tech at all, but it will count your steps. But there's a powerful connection between the brain and having this pedometer that it motivates you and keeps you going. So it's a great way to start. Yoga is fantastic because it combines deep breathing with exercise. So the deep breathing is key because at the diaphragm, at the bottom of the lungs, you have the last major reservoir of lymphatic fluid, which is cisterna chyli, which is, so when you do these deep breathing exercises, you kind of stimulate that reservoir and help push that last stretch of lymphatic fluid upwards through the chest into the neck, and then it drains to the heart. That fluid then goes to the kidneys and you excrete it, you pee it out. So.
Well, it's good to hear about yoga. I know nothing about yoga and don't practice yoga, but maybe I should. Yeah. But that explanation about the breathing and how that would affect the lymphatic system makes perfect sense to me. So there's a few other things that we want to talk about in terms of things people can do, but maybe we'll take a brief break now and come back and talk to Michele further about things you can do if you have lymphedema, and also about a special month that's focused on lymphedema. So we'll be right back.
Okay.
We'd like to take a moment to thank our generous supporters, the Hutton Family Fund and Banco Creative Studio, who help make the Cancer Assist podcast possible. The Cancer Assistance Program is as busy as ever, providing essential support to patients and their families. We remain committed to providing free services for patients in our community, including transportation and equipment loans, personal care and comfort items, parking, and practical education. These services are made possible by the generosity of our donors through one-time gifts, monthly donations, third-party fundraising, corporate sponsorships, and volunteer opportunities. Visit cancerassist.ca to see how you can make a difference in the lives of cancer patients and their families.
We're back talking with Michele Cardoso about lymphedema and how it's managed. And we were talking about exercise and yoga as ways of sort of naturally stimulating lymphatic flow. But then there are other things that patients can do. And in my reading, I didn't know anything about this before I read about it, but sort of manual self-massage as a technique, and the use of compression, bandages. So tell us a little bit more about those sorts of techniques and what patients should know about them.
So sorry, to step back for a minute, if you have some swelling, the first thing you should do is see your physician. Really what you want to do, whether it's a family doctor or your oncologist who's seeing you, you want to rule out other causes of swelling. Right. It could be a blood clot, it could be cancer recurrence, unfortunately.
Heart failure.
But yes, but often if it looks like a duck, it walks like a duck, it's a duck. Often it's lymphedema. And then the pathway becomes a little bit murky because people don't necessarily know what to do. And that's what I try to do in my role, is try to navigate patients to services. So in the community, I would say start with your lymphedema specialist. And there are many. And we have a list of providers on our website for the Hamilton Health Sciences website. They're fantastic people. Their background is massage therapy or physiotherapy most often. We have one that's an occupational therapist, but they've gone on to specialize in complete decongestive therapy, so they have the initial CDT after their name. So what they do...
CDT.
Yeah.
I had never heard that initial before.
Yeah.
Okay.
So what they do is a complete and thorough assessment of the patient. So above and beyond probably what we would do is in terms of we would measure limb circumference. So we go around and how big is the limb, and we use a measuring tape, which is a very basic way of doing it. There's much more efficient and technologically advanced ways. But they look at the limb volume, they look at pain, they look at your mobility, all of that. They give a very detailed education, similar to what we're talking about, but more tailored to the individual, and an exercise plan, and then manual lymph drainage as well. So manual lymph drainage is a light touch massage. It's just enough to move the skin, and it's not deep tissue massage, which actually can be kind of damaging in certain situations. So for people that know a massage therapist already or would like to go and see their familiar face to do that, I would caution that you really want to go to somebody who knows what they're doing, because you can move that fluid anywhere with some not so great results. So, and definitely some of those massage techniques can be taught at home, for you to do at home. Mm-hmm. So self-massage becomes part of your daily practice as well at home. Yeah.
And then apart from that, then the use of sort of compression.
Yeah.
To
so
help
when you go for lymphedema therapy for swelling, there's an initial intensive phase where you go 1 to 2 times a week perhaps, and then gradually that sort of decreases once the volume has been shrunk as much as we can possibly bring it down to normal. Then you want to go into this maintenance phase of treatment where you may be going every 6 months to see the therapist. What compression does is maintain.
Stabilize.
Yes. Any reduction that you get, the compression garment helps to keep it there. So I don't see compression as a standalone. It does work to some extent on in certain situations, like if you're exercising and you have swelling, definitely wear a compression sleeve. If you have lymphedema. But really what it's designed to do is keep the benefit that you've achieved through the therapy. So I would start with going to see a therapist, because actually the sleeves are quite expensive. Sleeves can be anywhere from $30 to $300, depending on how tailored they need to be for you. Mm-hmm. Really everybody's different, and your lymphedema specialist will sort of navigate that process and help you decide which way to go.
This is really important to know, because things have obviously changed since I was seeing women with breast cancer who had lymphedema, but it seems to me we just sort of said, get a compression sleeve, without the whole idea of going to see someone who could help you basically decompress it, get it down to the maximum amount you could, and then get an appropriately sized compression bandage that would keep it at that level. So I think it's really important for people to understand that there are these specialists out there who really know how to decompress the tissue of the excess lymphatic fluid. They
do say, if the patient went out and got a compression garment first, it's not wrong. It probably is better than not doing anything at all. But what happens is, a patient would go for therapy, and we're able to then reduce the limb volume, and now the garment doesn't fit.
Exactly. So and they spent $300.
Yes. So it's better to start with them. They become the quarterbacks in care. They will send the patient to an appropriate garment fitter. So there are lots of people involved in the care of lymphedema. So there is some financial support available for compression sleeves through the Assistive Devices Program, the Ministry of Health. It's a little bit of a cumbersome process, out-of-pocket expense usually for when you want to buy the garment. You would have to wait then. It needs a doctor's signature on the ADP form. But again, the lymphedema therapist can help you get all of that going.
Navigate through the process.
Yeah, and you need to have an authorized provider for lymphedema care and an authorized fitter. So and they're authorized by the ministry, so they're all identified. So if you go to a resource, let's say like the Lymphedema Association of Ontario, it will tell you who has authorization. Also, our list of providers is quite clearly demarcated who has that and who doesn't. So they're great. It's a great service that they offer. The lymphedema therapy itself is also quite costly, just like physio and massage therapy is. So some people have benefits that will cover that. Across the board, I would say it's $100 an hour, but they try to do it. The initial appointment certainly will be an hour, but beyond that, they try to make it a little bit shorter so that, and they'll work with patients if they say there's a financial hardship or they don't have benefits. They'll try and make a plan that's affordable and so on. And what I love about the ones that we have networked with and you'll see on our provider list is they're not interested in keeping a patient forever. They want to give them the tools to help them manage their disease themselves and go on and be productive and happy in their lives and be able to, they offload them, really.
So it seems like there's a lot of resources out there that
yes.
I wasn't aware of.
Yeah.
And even an association for lymphedema, so
yeah.
the Lymphedema Association of Ontario, they have a website where a lot of this would be
yeah.
readily available to patients and educational materials, I'm
yeah,
sure.
They're very good.
And the Juravinski Cancer Centre and Hamilton Health Sciences has a lot of this for
yeah.
our region listed.
Yes,
available.
so if you go to hamiltonhealthsciences.ca
mm-hmm.
and you go to the section on cancer care, there's a kind of a bulleted list that comes out on the side. It says community services. If you click there, there's a lymphedema drop down with all the upper body exercises, lower body exercises, list of providers, and a general kind of information pamphlet about lymphedema.
Fantastic.
Yeah.
Now, there's one group of patients I wonder what you do about, and those are the people who have head and neck cancers
yeah.
and often have extensive neck surgery disrupting all the
yes.
lymphatics and lymph
yeah.
nodes in the neck. And they can get swelling that affects their speech and their swallowing.
Yeah.
What are the things we can do for those?
Yeah, very
people?
Challenging, but treatable. We can reduce the volume. The lymphedema specialists can reduce the volume with the lymphatic drainage, and also there are specialized garments for head and neck cancers, which actually wrap around the face and head. So I mean, in that situation, and I think with any of the compression sleeves, the difference between lymphedema and cancer is it's out there. People can tell. And unfortunately, with the head and neck compression, it's quite noticeable. So people tend to wear them, more privately than outside. But the idea with any compression garment is to wear it as much as possible during the daylight hours.
We've covered a lot of ground about this, and actually you've educated me, and I hopefully educated a lot of listeners. Are there any other things that we haven't talked about? You did mention to us before we started the podcast about March being a special month with focus on lymphedema.
Yes.
What happens during
There's
that
World
month?
Lymphedema Day on March 6th, and it is a way of sort of creating awareness, because there really isn't very much awareness for lymphedema. We're really trying to bang the drum and make sure people know what to do if it happens to them and where to go. Also, we would like if the ministry on down could understand and support patients who have this debilitating condition a lot better than it is. It is very challenging to navigate right now.
Well, I'm hoping that this podcast is beating the drum, as
yeah.
you said, for the importance
There's one
of
group
lymphedema.
I should mention as well.
Yeah.
Sorry, I'll be in trouble if I don't. Whenever we make a diagnosis of lymphedema at the Cancer Centre, we also refer to the psychosocial oncology program. We have an amazing group of mental health workers, social workers, psychiatrists, mental health nurses, psychologists, because there is that aspect of the disease as well to consider. That feeling, the emotional impact, the compounding diagnosis. Patients do need support and navigation, and for the financial piece too, that they're able to, the social workers can step in. So by all means, we want patients to present themselves to PSO, or we can do that for them to make sure they're well supported through managing lymphedema.
Well, as I said, I've learned a lot about this, and I think the whole purpose of having the podcast is to educate those who are listening about what the options are for treating aspects of cancer. And this is one aspect of cancer management I think has been under-discussed maybe under-researched, and you mentioned earlier some very interesting research coming along that may make a big difference to people's lives. So I really want to thank you, Michele. This has been a very, very interesting conversation. I think very enlightening for those who've joined us. So thank you again.
Thank you. Thank you. It's wonderful.
Thank you for listening to the Cancer Assist podcast. Find more episodes, resources, and information at cancerassist.ca or follow the Cancer Assistance Program on Facebook, Twitter, and Instagram. We'll see you next time.